The World Health Organization criticized China's very narrow definition of COVID deaths, warning that official statistics were not showing the true impact of the outbreak. China has only recorded 22 COVID deaths since December and has dramatically narrowed the criteria for classifying such fatalities, meaning that Beijing's own statistics about the unprecedented wave are now widely seen as not reflecting reality. Now, WHO pointed out that the definition Beijing is using, quote, requires a respiratory failure associated with a COVID infection for a fatality to be registered as a COVID death. Let's listen in.
We know there are difficulties in all countries very often in recording hospital-related admissions and use of ICU facilities. But again, we believe that the current numbers being published from China underrepresent the true impact of the disease in terms of hospital admissions, in terms of ICU admissions, and particularly in terms of deaths. There are certainly issues in terms of the criteria for recording and reporting deaths attributable to COVID-19. We believe that definition is too narrow, which requires a respiratory failure in association with COVID-19 to be registered as a COVID-related death. That is a very narrow definition.
We continue to ask China for more rapid, regular, reliable data on hospitalizations and deaths, as well as more comprehensive real-time viral sequencing. With circulation in China so high and comprehensive data not forthcoming, as I said last week, it's understandable that some countries are taking steps they believe will protect their own citizens. This data is useful to WHO and the world, and we encourage all countries to share it.
We've seen the statement from the WHO's emergencies director that the current numbers being published from China underrepresent the true impact of the disease in terms of hospital admissions, in terms of ICU admissions, particularly in terms of deaths. I believe the same official went on to say that we still do not have complete data. That, of course, is the WHO's assessment. They are in the best position to make an assessment because PRC officials recently took part in discussions with them. The WHO is an indispensable organization. It is an organization that is at all times important. It is especially important in the midst of what still continues to be a pandemic that is having implications the world over.
Since COVID began, China has shared information and data with the international community in an open and transparent manner. We shared the genome sequence of the virus at the earliest opportunity, making important contribution to the drug and vaccine research and development in countries around the world. We have kept channels open for close communication at 3 levels with WHO's headquarters, Western Pacific Regional Office, and Representative Office in China. Besides all these, recently China's relevant departments have shared the genome data of the virus from COVID cases in China via GISAID. The WHO has noted on many occasions that the technical meetings between China and the WHO have gone smoothly and produced positive results. Facts have proven that China has always maintained close communication with the WHO and shared information and data on the epidemic in a timely, open, and transparent manner in accordance with the law. At the moment, China's COVID situation is under control. For all countries, COVID response measures need to be science-based and proportionate. We hope that the WHO Secretariat will take a science-based, objective, and just position and play a positive role in addressing the pandemic globally.
Now, there's growing concern over China's steep rise in COVID infections since Beijing last month abruptly lifted years of hardline restrictions, with hospitals and crematoriums quickly overwhelmed.